First of all, I would like to thank the organizers. So today, I'm going to talk about the prediction of trabecular-targeted micro-minimally invasive glaucoma surgery outcomes using anterior segment OCTA angiography. Trabecular-targeted micro-minimally invasive glaucoma surgeries (MIGS) have recently become popular as IOP-lowering treatments. MIGS enable the safe and quick relief of aqueous humor outflow resistance by cleavage or removal of the trabecular meshwork. However, the variability in their IOP-lowering effects are problematic, of which post-TM outflow resistance is thought to be a cause. Therefore, we think that it is important to visualize and evaluate post-TM outflow when considering glaucoma treatment. Recently, imaging methods of functional post-TM HO pathway, such as aqueous angiography, has received attention. AS-OCTA, as used in this study, is a relatively new technology that can non-invasively visualize the sclero-conjunctival vasculature. AS-OCTA could be used to visualize the post-TM HO pathway and showed that the OCTA vessel density in the deep layer was significantly associated with IOP in glaucoma eyes treated with eye drops. There have been no reports on the association of HO pathway assessed using AS-OCTA and the postoperative results of trabecular-targeted MIGS. The purpose is to investigate the association between preoperative AS-OCTA images and the postoperative results of trabecular-targeted MIGS. The participants were patients with primary open-angle glaucoma or preperimetric glaucoma who underwent MIGS such as trabectome surgery, microhook trabeculotomy, or suture trabeculotomy. Inclusion criteria were preoperative IOP of 15 mm mercury or greater, no history of intraocular surgery other than cataract surgery, no other ocular disease. If both eyes met the inclusion criteria, the eye that was treated first was included in the analysis. Exclusion criteria were as shown. AS-OCTA examination was performed using Flex Elite 9000. The AS-OCTA emphasis images were acquired in the nasal sclero-conjunctivals around the limbus. The trabecular meshwork was inserted in the nasal quadrant during MIGS for all cases. The vessel density was measured using an emphasis images of the superficial and deep layer, and the superficial layer from the conjunctival epithelium to a depth of 200 micrometers mainly comprises the conjunctiva, and the deep layer mainly comprises the sclera and episclera. Vessel binarization was performed using the trainable Weka segmentation plugin in Physi. The vessel densities were calculated for the anterior area, limbal area, and fornix area. The limbal area is inner one-third region, and it's represented by the blue area. The fornix area is outer two-thirds region, and it's represented by the red area. Surgical success was defined as shown. The IOP values were evaluated at 3, 6, 9, and 12 months postoperatively. 6 eyes were excluded from the analysis because of poor quality AS-OCTA images, and eventually 37 patients were included. Patients' background is as shown. There were no significant differences in age, sex, axial length, central cornea thickness, etc. IOP 1 year after surgery, the number of anti-glaucoma eye drops, and IOP change rate 1 year after surgery were significantly lower in the successful group. The superficial vessel densities were not significantly different between the two groups. The deep vessel densities in the anterior and fornix area were significantly lower in the successful group, whereas the difference in the deep vessel density in the limbal area was not significant. Multivariate analysis showed that lower deep vessel densities in the anterior area and the fornix area were significantly associated with better surgical success. Even after adjusting for a preoperative IOP, the number of preoperative anti-glaucoma eye drops, and combination with cataract surgery. Factors associated with the percent changes in IOP were examined using multiple linear regression analysis. The deep vessel density in the fornix area and preoperative IOP were significantly associated with the percent change in IOP. For case 1, it is in successful group, and the deep layer flow signal showed segmental patterns, and the vessel density was low, especially in the fornix area. For case 2, it is in unsuccessful group. A segmental pattern was disrupted and the vessel density was high, especially in the fornix area. Summary: the deep vessel densities of the anterior area and fornix area were significantly lower in the successful group. Lower deep vessel densities in the anterior area and fornix area were significantly associated with surgical success as defined above. A larger IOP reduction was significantly associated with lower deep vessel density in the fornix area and higher preoperative IOP. This study showed that lower preoperative deep vessel density was significantly associated with better surgical success and a greater IOP lowering effect. According to a report about aqueous angiographic outflow improvement after trabecular microbypass in glaucoma patients, when trabecular bypass was performed in a low-flow region, angiographic outflow improvement was seen. This was termed new recruitment. Although the mechanism is unclear, low deep vessel density assessed using OCTA may indicate recruitable vessels. Glaucoma caused by Sturge-Weber syndrome is known to be related to increased episcleral venous pressure. The deep vasculature in the corneal limbus with OCTA in Sturge-Weber syndrome patients was found to be significantly associated with increased IOP. And we previously reported the association between OCTA images and the IOP lowering effect of liposteal installation, and found that lower deep vessel density was significantly associated with a greater IOP lowering effect in normalized. Liposteal is a rho-associated protein kinase inhibitor. Because the IOP lowering effect induced by liposteal is thought to require good function of the post-TM HO, this result is consistent with our results observed during the current study. We considered that low intrascleral OCTA signals may indicate normal episcleral venous pressure and a healthy HO pathway. Limitations: IOP lowering eye drops may have affected our results, and it is not easy to obtain high-quality OCTA images. Future improvements in OCTA equipment and software algorithms might lead to greater utility of OCTA. And the sample size was small and the follow-up period was short. Intrascleral flow image assessed using preoperative OCTA was negatively correlated with surgical success and IOP reduction resulting from trabecular targeted MIGS. OCTA images might help predict MIGS outcomes. Thank you kindly for listening to my presentation.